Today, we're sitting down with Dr. Victor Dzau, the president of the National Academy of Medicine. The Academy serves as an independent healthcare advisor to the nation. They bring together experts from a diverse set of backgrounds to help create solutions on a national and even global level. Taking a deeper dive into the way the Academy approaches large-scale healthcare problems can give us insight into the way we can lead change in our own systems. All right, let's hear Dr. Dzau's take on this. Thank you so much for joining us on Doc Thoughts, Dr. Dzau.
It's a great pleasure.
What do you see as current gaps in healthcare?
This is the way I look at it. It's called value, right? Which is value in healthcare. Value, by our definition, is quality over cost. Can you actually provide the quality, the good clinical outcome, and the good experience? And how much does it cost? So that's value, pay for value. I do believe that currently the system pays for volume. The more you do, the more you pay. I think we need to shift towards pay for value. That is only looking at how good is the outcome and can people afford it. And of course, along with that would be access as well, right? People should have access to this. So I think that remains to be a challenge, and we're not there yet. Although it's getting there, there's going to be a lot of work that needs to be done.
So in your opinion, what would make for a quote-unquote good solution or a bad solution?
Good solutions are usually based on knowledge, not in politics or visual, right? A good example is firearms or gun violence. So we see gun violence as a public health issue. Yes, obviously people get really hurt from it. But when you think about this is a public health issue. It's linked with so many different facets. So when something happens, like happened in Florida, people visually say, oh, we got to arm all the teachers. We got to do this, we got to do that, based on no evidence. But there were evidence, we know where to intervene. If there's no evidence, we ought to do research to get that evidence, right? So bad decisions are made from a political and a visceral viewpoint. Good decisions are usually made on evidence. And evidence is based on having the research done to know what works, what doesn't work.
What is your approach to integrating perspectives across various medical specialties and stakeholder groups when designing a large-scale healthcare solution?
Yeah. I think whenever you design anything that involves a lot of people, you have to, first of all, be clear in your mission. What are you trying to accomplish? And your vision as well, right? And it should be a collective vision and mission. People support what they build. They need to come together and say, we share your values, we share your goals. Here's what we're trying to accomplish. That's key. So once you've got that, the next thing will be a good analysis of what's current state and where we want to be. Then, of course, you create a strategy, right? A plan to look at how we get there. And then you create implementation. How do you implement this? But the key thing is multi-stakeholders need to feel ownership. They need to share the same values. They need to share the same goals. They need to share the same risk and incentive. If you design that well, it's important. But coming back to why we do it, it's always about patients. It's always about making their lives better and their family. It's all about how science can drive decisions and evidence base. And so when you have the right people collectively believe in this, you can really, really do great things. The other important thing to recognize is that when you do this, you really ought to bring patients in, because they are, in fact, who we serve, and their point of view is very important. In the old days, doctors would say, we know better, we know so much knowledge, we're going to do what we know is good. Well, we learned that's certainly not the case, right? That patients have their point of view, they need to have empowerment, we need to hear them, they need to have trust for us. So I would say creating this includes patients' perspective as well.
What steps can medical students and doctors like us take to become innovators in our own healthcare systems?
So the key thing that I believe that we should all drive towards is asking the question, can we do something better? And do I have a good idea of how to do things, right? That's fundamental. So to me, first and foremost, that systems should create a culture of innovation. When I was at Duke meeting people in the community, that we're trying to serve. We sometimes forget. We think that what we have is a hospital, but what we have is a whole community. And unless you begin to address issues like social determinants of health, education, jobs, crime, you're never going to get to a point where we have the right society and improve health. The future is dependent on people, young or old, but willing to see the opportunity, being innovative, say, I want to make a difference. You know, as been the cliche goes, the future is yours. So I think when you can see something that is important and creative, you ought to go after it.